Good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll tell you about the electrogoniometry. So basically, it was first developed by the Karpovich in 1959. Electrogoniometer or ELGAN is more sophisticated goniometer used to record more precise angular joint movement. It is recorded by using the angle sensors such as potentiometer, strain gauges, accelerometers to record the measurements. It incorporates a potentiometer at the axis of two measurement arms. So change in joint angle are recorded as voltage fluctuations, providing a real-time analog display of joint motion. They are the best choice when it comes to measure the joint angle during dynamic movement. So the measurement arms are replaced by sensors and which are attached via adhesive tape, and the connection between the sensors is flexible. Most common electrogoniometers employ one of the following three sensor scheme. First, we are having the potentiometer. Potentiometric element is attached to joint rotation point. The potentiometer electrical resistance can be used to determine the angle between joints, and these type of electrogoniometers are somewhat bulky and restrict the patient movement. So this is the picture showing the electrogoniometer. Strain gauges, which are flexible electrogoniometer. Strain gauge is flexible spring with plastic and blocks on each end. It is housed inside the spring, which changes its electrical resistance proportionally to change in angle between plastic and blocks longitudinal axis. Lightweight, portable, these are applied easily, and they are currently the most popular electrogoniometers. So we are having the electrogoniometers in this picture. So this one is the telescopic end block, and this one is the fixed end block. So they are used primarily for research purpose to obtain the dynamic joint measurement. Most of the devices are having two arms similar to those of universal goniometer, which are attached to proximal and distal segment of the joint being measured, and resistance is directly proportional to angular displacement, and definitely thus the resulting change in voltage will be used to indicate the amount of joint motion. So versatile use due to flexible axis. So flexible spring connection between two goniometer block compensates for any joint migration and surface prolongation, which is especially helpful in shoulder joint and spine motion. It also allows for placement of sensor on uneven surface. So we are having some examples like SG65 for wrist, SG75 for large area, elbow, ankle and neck SG110, SG150 for neck and hip. For back we are having the SG150B. So these are this picture is showing the electrogoniometer. So in this way we can measure the hip, knee joint range of motion, back, elbow. So how recording is done? Usually the joint angle is stimulated by stepper motors controlling the movement of segments connected to accelerometer axis, and they send these accelerometers send electrogoniometer and analog signal proportional to angle of each segment, which then converts the analog signal to digital signals and extract the angle information by using the simple linearization techniques, and this information then is sent to the computer and then it is displayed. And the student recording the data should also plug the goniometer sensor into the test equipment. Make sure the graph is set up to measure the angle versus time, and the graph setting should be set to data cursor and connected lines. So we are having the types like protector with potentiometer. It can be used for movement in one plane only, and it is used to measure the hinge joint angular movement also. So it is also advancement of simple electrogoniometer and been developed to measure the rotation in non-hinge joint about 2 to 3 axes also. So advantage is that it provides the real-time display, rapid collection of single joint information on many subjects. It is also suitable for gait analysis and simple, immediate and reliable way of obtaining the information. So there are some limitations also, like it become cumbersome in some clinical application. Recording of fast movement is problematic for potentiometer axis relative to joint axis, and attachment of ELGAN to limb of subject may alter the movement pattern. Somewhat it is time consuming because it hectic time in fitting or aligning, and also wire accessories cause further complication. These are the references. Thank you.